Evening, everyone. Can you listen to me?
Good evening, Mrs. Inas. Yes,
Okay,
yes, we can.
thank you, Sergio. And I will share now, maybe. I don't know if you can see it.
Yes, I can.
Perfect. Okay, let's go where we left the slide yesterday. And I will ask, please, Valeria Guerra.
Yes.
Hi. Can you
Hi.
read this part, please?
Yeah, sure. MRI and ultrasound. Magnetic resonance. It's safer to X-rays. It's safer than X-rays because it does not use radiation. It provides more information than computer tomography about some head, neck, and spinal disorders because the images are more detailed and have more contrast, meaning that the difference between dark and light areas are stronger. Unlike CT, the images can be taken on any plane, any surface of the body seen from an angle. It is now used for imaging taking images of the brain and heart and in oncology. Contraindication. In cases in which it should not be used, include patients with metallic foreign bodies and orbits, and patients with pacemaker electronic devices surgically implanted to regulate heartbeat. MRA is also not approved during the first trimester of pregnancy.
Okay, thank you so much. And I think we already saw this slide, right? Just to make you remember about this part. And ultrasound, maybe Vale Mercado? Can you read this part, please?
Good evening, everybody, and ultrasound. Ultrasound examination use high-frequency sounds waves to view organs and structures inside the body. The waves are generated and received by a handheld device called a transducer. The reflected waves are processed by a computer which produce detailed image for display on a monitor. Ultrasound is safe as it does not imply ionizing radiation like X-rays. It is a cheap, quick, and non-invasive investigation with no surgical procedure for a wide range of referrals. Although results can be unsatisfactory in overweight patients.
Thank you. I don't know if you have any questions here for vocabulary, maybe. Do you understand how it works? Or do you want to add something else? Nothing? It means everything is clear here?
Yes, Miss.
Okay, let's continue then. Thank you. Um, Jorge, can you read this part, please?
Sure. Can you hear me?
Yes.
Okay, perfect. Preparing for medical imaging, preparing for an MRI scan. You will need to have completed a safety questionnaire and have it with you. It is important that there is no metal on your clothing or person. Prior to the scan, you can eat and drink normally. Your details and safety questionnaire will be checked with you by the radiographer, who will explain the procedure and answer the questions you may have. You will be asked to remove any metallic objects as well as credit cards.
Okay, thank you so much. Do you have any questions here? For example, do you understand prior to the scan this sentence?
Can
Trina?
hello. A prior teacher, that this probably means that is indispensable, or is a priority or important indicator?
In this case, prior means previously.
Oh,
Before to the scan, you can eat and drink normally.
okay.
In this case, okay? Thank you. Anyone else? Any question here? Any other suggestions we can add here?
To remove necklace or earrings.
Okay. Okay, Vale, thank you. I think everything is understood, right?
Yes.
Perfect, thank you. Let's continue. Sergio, could you read this part, please?
Of course. You will be asked to lie on the MRI scanner table and make yourself comfortable. The radiographer will position the part to be scanned carefully in the scanner. During the MRI scan, you will not feel anything, but you will be required to stay still to achieve the best possible images. The whole examination process takes approximately 45 minutes. You will not require any injections. Preparing for an ultrasound, you will be asked to lie on an examination table. A special gel is applied to your skin. This ensures that there are no air pockets between the transducer and your body. That transducer is moved over the area to be examined. You may feel some pressure and experience some discomfort, especially if the test requires you to have a full bladder. You may be asked to change your position for clearer pictures. When the radiologist is satisfied with the picture quality, the test is done and the gel is wiped off. A typical test may take between 20 minutes and 1 hour. Describing medical imaging. An ultrasound scan of the liver revealed reduction of metastasis. An ultrasound scan of the abdomen demonstrated a small right renal tumor. An ultrasound scan showed an intra-abdominal abscess.
Thank you, Sergio. I
You're
think
welcome.
this part is clear, but if you have any questions, please let me know. I know you're not a technician in radiography, of course, but I don't know if you want to add something else. So is it clear? Can we continue?
Yes.
Okay, thank you. Carla Calle, can you read this part, please?
Yes, teacher. ECG, uses for
Yes.
an ECG, an electrocardiogram. ECG is a tracing or drawing produced by an electrocardiograph, a device which records electrical activity in the heart. An ECG can be used for deciding if the heart is performing normally or suffering from abnormalities, for example, cardiac arrhythmia, extra or skipped heartbeats, indicating damage to the heart muscle, such as heart attack or ischemia of heart muscle angina, detecting conduction abnormalities, heart blocks, and bundle branch blocks, BBB, screening for ischemic heart disease during an exercise tolerance test, often carried out on an exercise bike or treadmill, providing information on the physical condition of the heart, for example, in patients with left ventricular hypertrophy, LVH, and detective electrolyte disturbance, for example, low plasma potassium levels.
Okay, thank you so much. In this part, do you understand the word tracing?
Like drawing.
Right?
Like
Sorry.
drawing.
Drawing. Could you explain?
Drawing.
Okay, but could you explain more?
Like drawing lines up and down, I don't know.
Okay, it's an example.
Drawing in a paper the electric system of the heart.
Okay, thank you. And anyone else?
Tracing, it's groups of the lines that express the electronic movement or electronic activity of the heart. For that reason, tracing is probably a drawing that express the cardiac function in the electronic way.
Okay, that's a good explanation. Thank you. Anyone else? Nobody? I don't know if you can look for this word on the dictionary, please. Let's see if it's the right definition.
About tracing, teacher.
Please.
Tracing is trazado. That is
Okay.
the best word. Yeah.
Okay, thank you so much. Perfect. Any other word that you're looking for here? Or any sentence that you cannot understand? Everything is clear?
Yes, it is, Ms. Encinas.
Thank you, Sergio. Okay. Let's continue. Andres, you read this part, please.
Yes, teacher. ACG brochure. Here is an extract from a medical textbook. 1. The patient should lie down and relax. 2. Calibrate the ECG machine and standard signal of 1 MB. Show move the stylus to learn square vertical. 3. Attach the limbs left arms LA, right arm RI, left leg LL, and right leg RL. 4. Record the 6 external legs 1, 2, 3. Augmented voltage right arm AVR, augmented voltage left arm AVL, and augmented voltage foot AVF. 3 or 4 complex for each. 5. Apply the electrode to the 6 chest position in turn, recording 3 to 4 complex of each. If the rim doesn't not appear to be sinus, normal rim, a ring strip of 6-10 complex in a single leg should be recorded.
Okay, thank you, Andres. So we have the patient should lie down and relax. Number 2, calibrate the ECG machine. A standard signal of 1 MV should move the stylus to large squares 1 centimeter vertically. 3, attach the limb leads or maybe connect to the limbs. Okay, left arm LA, right arm RA, left leg LL, and right leg RL. Number 4, record 6 standard leads 1, 2, 3, augmented voltage right arm, augmented voltage left arm AVL, and augmented voltage foot AVF. 3 or 4 complexes. Okay, for each. Number 5, apply the electrode to the 6 chest point in turn, recording 3 to 4 complexes of each. If the rhythm does not appear to be sinus, that is a normal rhythm, a rhythm strip of 6 to 10 complexes in a single lead should be recorded. Okay, it seems to be so complex, right? Maybe a technician would work with this easier than us. But I don't know if you have the chance to operate this kind of machines or to watch maybe how it works.
Yes.
Could you tell us your experience, Carlita?
Well, I have an ECG in my consultorio. I don't know how to say it in English, but I used to do ECGs for chronic patients like diabetes or hypertension once in a year. So it's easy. It's not difficult to do.
Okay,
You
it's
have-
not
you-
as complex as it seems.
Yeah, it's easy. You just have to put these electrodes
Mhm.
in your arms, foot, and in your it is called precordial spaces
Okay.
in your chest, and you just have to record to print it.
Okay, thank you so much. Does anyone wants to add something here or maybe has another experience?
Yes, teacher. For me, ECG, the procedure is it's a situation that I have to learn when I was a student around the fourth 5, 6 years of the careers, because it's very common in the emergency in the hospital, make a ECG to the patients. For another way in the clinic, it's a ECG procedure. It's very easy, but I don't know why the interpretation is a little complicated for some colleagues. Nevertheless, that the procedure that explained here is the basic procedure, because in another situation, it's not only 6 position. We can use, or we have to use 12 different positions, but depends to the condition of the patient, or what I have to, or what I want to study in the ECG. But it's very interesting.
Okay, thank you. Thank you so much, Reina and Carlita. Well, I don't know if you understood this part or you have any questions, so we can get into the other subject. Any questions, guys? No questions? Okay. Okay, let's talk about medical treatment. Mateo, can you read this part, please?
Teacher, we are watching. You're watching the last presentation, class 9. It's on the screen.
Okay, I'm still watching. I'm gonna close. Share again, please. Okay, what about now?
Okay, now it is.
Okay,
It's good.
let me make bigger this presentation. Okay, go ahead.
Okay. Prescriptions and drugs. As part of the treatment, a doctor may prescribe medication, commonly referred to as a medicine or drugs. A prescription may take these forms: tab of nabumetone, 500 milligrams, mite 56. I don't know. Yeah, 56.
It is.
Say to tab nocte. I don't know how to pronounce that.
Not. Okay.
That will be in the deed style, and new style is nabumetone tab 500 milligrams, send 56, and label 2 tablets at night. In the UK, patients take prescriptions to a chemist, which sells a wide range of non-prescription medicines and other products such as cosmetics. For dispensing by a pharmacist, the person who prepares the medicines. In hospital, prescriptions are dispensed by the pharmacy, HTE department, where the drugs are prepared. Note: Latin abbreviations in prescriptions are being replaced by English, but may still be seen.
Okay, thank you so much. Yes, we have the how they used to write the prescriptions. Okay, and the new style. Tab might be for a pill. Okay, I don't know in your countries what is the style of making a prescription. I mean, you put the name of the patient, the age of the patient, and what else? What goes first? is the same way that is right here, or you have another way? Hello.
Um, I have a question. When that express send 56 is the number of the pills.
It
When
seems
they
to be the number of the pills in this
okay.
case. Okay.
Okay.
Eh,
Well, in that case, well, here in El Salvador, the prescription adds in between parentheses, it's usually the commercial name if necessary, but not always. And another part, it is more, we are more specific about the how many times. For example, 2 tablets each 8 hours, for example, in the morning and in the night, for example, or the time each 8 hours for 10 days. That is another part we add in that prescription.
Okay, thank you, Rina. I think it's the same for us. Maybe we try to help our patients by giving them the right schedule, so they don't miss taking their pills, right? Someone else wants to add something here?
Maybe the day of the medicine prescription.
I'm sorry, can you repeat that, please?
Yes, the day of the
Okay, the
prescription.
date. Okay,
Yes.
that's important. Yes. Yes. What else?
Maybe close the receipt for um, close the receipt because some patients can add other medicines.
Okay, that's important too. Thank you, Ali. Yes, that's really important. Anything else? Nothing else? And the most important thing, some of you sign this prescription. Yes, no.
Yes, we need to put our signature.
Okay, thank you so much. Do you have any other questions here?
No.
Let's continue then. Well, here we have, just to let you know, the British National Formulary provides information on prescribing and administrating prescription drugs in UK. Okay, so they give you the name of the medication, the indications, causes. It's everything that we have on our drugs, right? What we have to. So it is important to explain sometimes the patient. I don't know if you do that or you just prescribe it. Maybe some patients ask, they are so specific asking these questions. I don't know if it will cause me another thing, or maybe, I don't know. I don't know if you have this problem, or you just send your recipes and that's all. Do you take the time to explain to your patients these specifications? For example, collateral reactions.
I guess as a doctor or a physician, most of the times we don't take our time to explain it with detail, but we should, right? But I mean, there are like important cases, specific cases where you have to explain everything with lots of detail. Um, but yes, I mean, all the cases be should have this kind of explanations, right?
Okay, Sergio, thank you. Yes, of course, not all the cases are such or have such important explanation to be so specific, but we need to tell the patients because they come with some troubles later, maybe because they didn't understand how to use it. Okay, so it's important to explain to our patients. Thank you so much. Okay, Rina, could you read this part, please?
Hey, teacher. An indication is a situation or a sign that suggests a specific treatment should be given. A contraindication is a situation or sign that a specific drug or treatment should not be used or is contraindicated. Exelderm is a proprietary commercial name for a medication containing sulconazole nitrate. The same drug may have both a proprietary name and a generic name. For example, Prozac and fluoxetine are the proprietary and generic names for the same drug.
Okay, thank you. This just to mention, because we have a lot of drugs and that has a commercial name and a generic name, right? Do you have any questions here? I guess no. Okay, Jethro, could you read this part, please?
Yes, teacher. Surgical treatment. The operating surgery is carried out in an operating theater. Great care is taken to make sure that operations take place in sterile conditions, free from microorganisms. The surgeon and his or her assistant was or stripped up and put on surgical gowns, a mask, and gloves. This is known as preparing the patient. They are then covered with the sterile drapes so that only the area of the operation is exposed.
Okay, thank you. When we talk about the surgical gowns, we are talking about this, the suit or the cloth the surgeons use on the operating theater. Okay. I don't know if you have any questions for vocabulary. Everything is clear here?
Yes.
Thank you. Well, we have some names of surgical instruments: the retractors, artery forceps, scalpel, scissors, and dissecting forceps. The operation. Melanie, can you read this part, please?
Yes, miss. The operation begins when the surgeon makes an incision or cut. Control of bleeding is very important. A swab is a pad of cotton or other material used to suck up blood from the operation site. A sucker is a mechanical device which aspirates sucks up blood. Bleeding vessels are tied with ligature or sealed by an electric current, the attorney. Drains may be inserted to carry away fluid, which might act as a culture medium for bacteria. For example, sutures, also known as stitches or staples. Finally, the wound is covered with a dressing.
Okay, thank you so much. Do you understand what is a swab?
In Spanish would be torunda.
Yes, yes it is. Thank you. Okay. As you can see, a sucker is a mechanical device which aspirates, sucks up blood. Bleeding vessels are tied with ligatures or sealed by an electric current that is called diathermy. Okay, drains may be inserted to carry away fluid, which might act as a culture medium for bacteria. Remember about this definition, culture medium, that we were saying that we needed to make a research about it. Remember? Like in Spanish, it's called urocultivo. Jorge, do you remember about this?
Yeah, actually, I think you told us to search about it. I don't remember the specific question, but I think we left it like later.
Yes, it was because the meaning, if we make a research, the meaning of urocultivo was a culture urine, and we have the doubt. So now that we can see here, yes, it is used as a culture, como cultivo. Cultivo, la traducción sería culture. Okay, in these cases. So the translation was good. Do you understand now?
Yes, teacher.
Okay. Do you have any other questions? Do you understand the word staples?
Okay, staples are like the little pieces of iron that we also use, for example, for papers to put them together. I don't know if I'm explaining well, if everybody understands.
Yes.
The translation would be grapas.
Okay, thank you so much. That was clear. Okay, no more questions here. Everything is clear.
Yes, teacher.
Perfect. Ale, could you read this part, please?
Sure, teacher. An operations report. This patient had an indirect right inguinal hernia, anesthesia, spinal anesthetic with local anesthetic infiltration, incision, right inguinal, procedure. The external oblique aponeurosis was divided and the spermatic cord mobilized. The hernial sac was identified and separated from the spermatic cord. The hernia sac was then mobilized back to its neck where it was transfixed and the reductant tissue excited. The fascia as the neck of the spermatic cord was divided, carefully preserving the vellus. The genital branch of the nervous and the nerve and the vas deferens. Thereafter, the posterior wall of the inguinal canal was repaired in 2 layers.
Okay.
Closure. The wound was closed in layer with detox suture material to the external oblique aponeurosis and stapled to the skin.
Okay, thank you so much. Well, as we can read in this report, we have some new words. I don't know if you have any questions here. Okay, I will make the questions. What is the hernial sac? Nobody?
The hernial sac is the tissue that contains the hernia.
Thank you.
It's like a bag.
Perfect. Do you understand? Who can tell me in Spanish what is the hernial sac? Why are you so shy today?
Hello, teacher. I'm sorry. What is the question?
What is the, do you understand what the description or the definition that Mateo makes about the hernial sac?
Hernial, what part? I cannot find
Okay.
this
It's
part.
in the-
Hernial sac.
Yes.
How like that? Hernia is a condition when especially or specific in a part of the intestine, a small intestine, is out, belong in a, or orificio natural of the peritoneal area in the abdomen, and that part precisely of the intestine stuck in that orificio. So that is hernia.
But the question was, what is the hernial sac?
And the sac
worry.
is saco.
That was I was asking. But thank you. Thank
Okay.
you so much. Okay. Another word that you don't understand.
When that says close in layers
Layers.
layers in English, in Spanish is cerrar en capas, teacher.
That's good. Thank you,
Okay.
Rina.
Thank you.
Thank you. Other questions, or do you think we can continue?
We can continue.
Perfect. Thank you. Well, we have here therapies and radiotherapy and chemotherapy. Radiotherapy is the use of radiation in controlled doses to treat cancers. Sorry. It works by damaging the DNA of malignant cells, and radiotherapy may be used as curative treatment, for example, to shrink tumors, as adjuvant treatment alongside of following chemotherapy, or treatment with anti-cancer drugs, in lower doses as palliative treatment to reduce pain and other symptoms of cancer or disease, but not as a cure. A radiologist determines the dose and the exact target for the radiation beams. Dosage is measured in grays, okay, GY. A daily dose is a fraction. Radiotherapy can also be delivered internally by radioactive implants, such as needles, or by liquids such as strontium for some bone cancers. Okay, do you have any questions here? Or maybe do you want to add something else?
Teacher, there's radiotherapy that is localized in the tumor. So you can put these, I don't know how to say that in English, but are little tubes that you put from minutes to hours and also days. And then you take it out, and that's the therapy. It's more localized.
Okay, and the name of the therapy is?
I don't remember. I'm gonna search for it.
Okay, I think you're talking about the chemotherapy.
No, no, it's radiotherapy.
Oh, okay.
So they are little tubes.
Okay, thank you.
I'm gonna search the name.
Please.
I
Does
think the
anyone
name is targeted therapy.
Oh, yes, we were talking about last class about that, right?
Yeah.
Thank you, Mateo. Okay. Any other thing do you want to add here? Everything is clear? Do you understand the meaning of this sentence as adjuvant treatment? Do you understand? Okay, it's like an auxiliary treatment, adjuvant. If you don't have any other questions, can we continue then?
Yes.
Perfect. Okay, a day in the life of a physiotherapist. Jorge, can you read this part, please?
Okay. Sam is a hospital physiotherapist. She works mainly with patients who have conditions or injuries affecting the lower extremities, such as fractures, torn ligaments, and cartilage tears. Most of her patients are referrals from other departments in her hospital. She also works with patients in rehabilitation following orthopedic surgery. Some are young people with sports injuries, others are elderly people who have had hip replacements. Among her therapies are manipulation, massage, and exercise to keep the joints mobile and to strengthen muscles. Rehabilitation, some patients means helping them to walk again using crutches or Zimmer frames.
Okay, thank you so much. Before we continue, Carlita writes something on the chat. Brachytherapy might be the name of the description she made. Okay, just to let you know. Well, as you can see, we have this patient on the left side with crutches. Okay, those are crutches. And we have here an older patient on the right side with a Zimmer frame. Do you have any other question for vocabulary? Or maybe you want to add something else? Nobody? Everything is clear? Okay, I will take that silence as if everything is clear. Well, we have here another type of therapy. Maybe Claudia, are you here? Okay, Sergio, can you read this part, please?
Of course. Cognitive behavioral therapy, or CBT, is one of the talking therapies for mental health conditions. It aims to eliminate negative thoughts and change behavior in response to these thoughts. It can help with anxiety, panic attacks, depressive disorders, post-traumatic stress disorder, and chronic fatigue. Therapy can be effective. It is more effective than counseling for some and can provide long-term protection against relapse, a return of symptoms after improvement. However, patients must be committed to solving their problems and prepared to work on them between sessions.
Okay, thank you so much. Do you have any questions here? Have you ever used this kind of therapy?
No.
Okay. Is it new for you, this kind of therapy, or did you already know it?
For me, it's new.
Okay, Vale, thank you.
Teacher, it could be similar to auto-suggestion. No,
Okay, is it the type of therapy that you use on your consultation?
no. But there's some alternative therapies that some people use.
Okay, can you explain or describe a little bit?
I was reading a few days ago that autosuggestion is used like similar to hypnosis. So they can work with the patient to block the pain, and they can have some procedures. So the patient does not feel the pain.
Okay, that's a good therapy. Any other thing you want to add here? Thank you, Carlita. No? No more questions? Okay. Okay, we already finished this part. Do you have any questions here on about this class? I don't know. You're not asking. I think everything is clear. I hope you are writing down your questions so we can solve tomorrow on the practical class, okay? Am I?
Hey, teacher.
Okay. So tomorrow we will have our practical class, as I told you. And remember your schedules, right?
Yes, teacher.
If anyone won't come for any reason, please let me know before we start at 6, maybe, or 6:45. Okay. I don't know if you can watch my questionnaire.
Yes, teacher. I don't.
Please read it for me. You. 7, 8, 11. One more, please. Or 2 more. Everyone can see my questionnaire.
Yes.
Yes.
Perfect. Just a few minutes. Okay, one more, and I'll let you go. Okay. Just a picture, and you're free to go. Thank you so much, guys. And any question you have about this, please tomorrow let me know, okay? Thank you. Have a great night. See you tomorrow.
Bye, Mrs.
Thank you,
Inez.
teacher.
Goodbye,
Bye.
teacher.
Thank you, teacher.
Bye.
Bye.
Thank you.
Bye-bye. Jocelyn. Hello, Jocelyn.